Weimar and Deputy Secretary Kate Matson from the Department of Health to provide the daily update on the coronavirus situation in Victoria. So yesterday there were 20 newly locally acquired cases, 5 of which were in quarantine for their entire infectious period. Kate will talk to those in more detail shortly. Currently, we have only 2 people in hospital. That is 2 too many, and for the first time in quite some time, no one in ICU. Can I particularly thank the some 34,892 people who came out to get tested yesterday? And can I also thank the 22,670 people who came through the vaccination centres that the state runs, and I'm pretty sure an even stronger number through our GP partners and the primary healthcare system. In regards to the state-run centres, that's the biggest day of vaccines administered since the 5th of June, and I would continue to encourage people to come forward in strong numbers as their availability across accessible vaccine sources and options continues to increase. Yesterday was day 1 of our expanded access to the safe and effective AstraZeneca vaccine. We administered 2,366 first doses of that vaccine yesterday. That is a more than 3-fold increase when compared to the Monday of the previous week. So I think that just, and we'll come back to it, gives strong emphasis to the fact that young people in particular, under 39, want to get vaccinated. Clearly, young people have assessed their personal situation in a strong and informed manner, and many are determining that there are significant risks in remaining unvaccinated during a Delta outbreak and during lockdown, and they've made a balanced and pretty straightforward decision as to where their interests and the community's interests lie, because they know it's not just about them. Young people are coming forward to get vaccinated. They're doing it for themselves, they're doing it for their family, they're doing it for their local community, their sporting clubs, their cultural organisations, they're doing it for their workplaces, and they're doing it because they want to get to a COVID normal world as rapidly as we possibly can, and getting vaccinated within the restrictions of supply that we are operating under is their contribution. Many are also doing it for their schoolmates and their university friends. And that's why when last week we were notified of a case at the Altaqua school via a teacher, we set up the very next day a pop-up vaccination site on site at that school as a trial for how that situation would evolve, again within the constraints of limited supply. The Altaqua pop-up clinic has so far administered 1,252 doses. 1,252 doses in a school community that size has been extraordinary. That's more than half the school, and keep in mind that many of the families had also gone to other vaccination centres, be it the big hub at Sunshine, the showgrounds, the GP networks and a range of others. And some have already in fact been vaccinated. So can I give Altaqua School a really big shout out for the impressive way in which the school leadership, the school community and their families have all come together in an extraordinary way to have amongst the highest levels of testing and amongst the highest levels of vaccination of any school community that we've seen over the course of this outbreak. Yesterday we also saw cars roll up to the first drive-through vaccination centre in Australia at the Meltons, the old Meltons, the old Bunnings in Melton. And can I just reinforce that you just can't drive up, you've got to book. And the bookings have been extraordinarily solid. Later in the week, it will also become a walk-in clinic as well as the driving clinic. But again, please book. It is so important. We just don't want people being disappointed as they show up because we still have constraints on supply. Today, a dedicated pop-up response for vaccination centre will be also established for the school communities in the Wyndham area. We'll go through the other schools that will be impacted by that. But again, this is as part of that expansion of trials to make sure that because of this particular outbreak having such a strong focus on school communities, we want to dedicate the response where the need is the greatest. In addition to that, over the next month, I can tell you that there are some 333,000 vaccines appointments already booked. A third of those are for AstraZeneca. So AstraZeneca has demonstrated itself to be safe, effective and increasingly available. On top of those 33,000, a further 50,000 appointments have opened up over the next month, and 21,000 of those are now available for AstraZeneca. That takes us to some 319,000 vaccine appointments available over this forthcoming period. Obviously, most of those, because of the availability of new vaccines coming on, are at the back end of the month, but what it does reflect is a growing preparedness by Victorians in the context of the Delta outbreak to take the best available vaccine, which is the one that's available. And at the moment, that's AstraZeneca and Pfizer, and as more vaccines come on, I'm sure that will expand when we are given access to those. Just to reinforce, AstraZeneca is safe, effective and available. I got AstraZeneca, the Chief Health Officer got AstraZeneca, Jerome has had AstraZeneca. It's safe, it's available and it's effective. And we all did it. All Victorians who have been vaccinated have done it to protect themselves, to protect our families and to protect the communities that we're a part of. And we look forward to the hundreds of thousands of people in the coming weeks doing the same thing and coming forward to get us on this pathway out of the systems of having limited options when it comes to outbreaks. I was pleased that midnight last night restrictions were eased in regional Victoria, but can I use this as an opportunity to say that what has happened in regional Victoria is we have gone back to the still significant restrictions that are in place prior to last Thursday. Masks are still required indoors and outdoors, and please, no visitors to your home. It is not permitted. And if you live in Melbourne, that means that you can't head out to regional Victoria to stay in your regional holiday home should you have one. That's not the reason to leave. There's 5 reasons to leave in Victoria, in metropolitan Melbourne, still apply, and they apply for very good reason. I see that today New South Wales had, sadly, a record day of vaccination, of infection numbers. That should serve as a strong reminder to all Victorians as to why we need to continue to follow the public health rules and make sure that we get back to the situation that we were in only very recently as soon as we possibly can. I'll ask Jerome to say a few words, then Kate, and then I'm happy to take questions.
Thank you, Minister, and good morning. 20 new cases overnight, and Kate will go through the details of those cases and how they fit into the outbreak, but I'm pleased to say all those cases are linked to people in hospital, unfortunately nobody in ICU, and of course we send our best wishes to those Victorians who continue to recover from coronavirus. There are 111 active cases of coronavirus in Victoria at the moment, both across the current outbreak, so 76 of those are associated with the current outbreak, and the remainder are a combination of the old cases coming off the previous outbreak and, of course, some hotel quarantine cases. Just over 12,000 primary close contacts spread across a number of our exposure sites, a significant number of those associated with 9 schools that we have that are currently associated with aspects of this outbreak. The area of most concern to us today is Caroline Springs, and continues to be Caroline Springs. We discussed it a little bit yesterday. We've seen now 25 cases associated with the Caroline Springs Square shopping centre across a number of different units, a number of different retail units and people. Some of those are household contacts. We have listed yesterday, as we confirmed, the entirety of the Caroline Springs Square shopping centre as a Tier 2 site between the 27th of July and the 5th of August. And I would again urge everybody who's been to that shopping centre over that period, please come forward and get tested immediately if you have not already done so. There are a number of, on our website, there's a number of particular retail units and businesses in the area that we have highlighted. I'll name some of them today, but I would urge everybody, please, if you've been in the Caroline Springs area, excuse me, then please do check our website for details of those units. They include YPA Real Estate, BWS, Aldi, Caroline Springs Pharmacy, and the Spectacle Hub. As I say, there's a number of other locations, but please, I would urge anybody who's been to those venues or the other Tier 1 sites, please come and get tested as soon as possible. Continue your isolation. If you've been to other parts of that shopping centre, please come forward to get tested and wait for your results. As part of the 34,892 test results yesterday, there were 400 tests done at the pop-up testing site that we put into Caroline Springs yesterday. There are now 2 additional testing locations available at Caroline Springs today. One is the City Vista Sports Precinct, and that's a drive-through. There is also a walk-up facility available at the Caroline Springs Leisure Centre. Again, I would really urge, I need those numbers to increase. We need to see more people in the Caroline Springs area coming forward for testing. It's a busy, important shopping centre. And can I also just add my thanks for all those retailers and businesses in the shopping centre. I know it's incredibly distressing to be part of an exposure site. This is of no fault to any of the businesses concerned, let alone the individuals concerned. But as we know, the virus doesn't stop for anybody and doesn't stop for any business. It's our job now to ensure we follow all those chains of transmission and run it to ground in that particular locality. In addition to the 2 testing sites we've identified, there are, of course, good testing opportunities for drive-through at the Melbourne Showgrounds, at Victoria University at St Albans, and at the IPC Health at West Sunshine. In addition, there's, of course, the big walk-up site at Sunshine Hospital. The other areas of the outbreak really relate to some examples of transmission at school sites and, of course, more widely in the community. Last night, I went again to join the team at Flemington Towers, at Racecourse Road. 3 of the cases that we've identified in these results are positive cases that reside at the 2 towers, at 130 Racecourse Road and at 126 Racecourse Road. Those positive cases and their families moved out last night. And my thanks to those families for agreeing to move into hotel quarantine. It is, of course, a very anxious and distressing time for those families. It's very distressing to have, in this case, children identified as positive cases, but they are now in the safe and best possible place that they can be. Also, really good to see the team at Flemington last night from Co-Health and our local community leaders who are working so hard to bring those connections together to make sure we've got good relationships, good information going around the precinct. We had a very busy few days there over the last 2 days to test everybody within the main tower, 130 Racecourse Road. I'm pleased to confirm that around 2/3 of those test results have already come back as negative test results, and we'll be continuing testing today at 126 Racecourse Road. Can I just stress there are no positive cases or no known positive cases at this point anywhere in the Flemington estate. The estate continues to be safe. and we have asked all residents of 126 Racecourse Road, they are all Tier 2, so they all need to get tested today or tomorrow over the coming days and isolate until a negative test result. We have already tested 130 Racecourse Road. We will do some more additional testing there during the course of today. We've also worked exceptionally closely, and again, my thanks to the school leaderships of the schools involved in this outbreak, in particular the school communities at Ilim College, at the Islamic College of Melbourne, the Mount Alexander College, and our friends at Al Taqwa. We've really seen the most phenomenal engagement through those school communities over the last few days. Kate will go through some really outstanding test results for those schools. And again, we continue that dialogue over the coming days. That is why I think this community response is going better than we've ever seen before, and it attributes also to the good work being done at Showgrounds by a whole range of agencies and partners. Finally, 767 home visits yesterday. Only 4 required any kind of follow-up. And again, my thanks to all those 767 people and everybody else who's doing the hard yards of isolation, whether you're a primary close contact, over 12,000 of them, whether you're a red zone returnee or somebody coming back on an exemption. Making sure you comply with those directions is very important to keep all of us safe. We continue, of course, to meet flights at the airport. 18 flights came in yesterday from red zones, extreme zones and orange zones. All were met. 94% of passengers had the right paperwork when they landed. They all had the right paperwork when they left the airport and went to their appropriate way. With that, I'll get Kate to do the headlines of today. Kate.
Thank you, Jerome. Good morning. As the Minister mentioned, we have 20 new cases to report on today. 10 of those are linked to CS Square in Caroline Springs. I'll break down those 10. 4 of them linked to YPA Real Estate, 3 work at that estate agency, and 1 is a household contact. 3 are linked to the Jolly Miller Cafe, 1 worker and 2 household contacts. 1 is a worker at the Pacific Smiles dentist, and the other 2 have attended the shopping centre precinct in general. That's 10 cases. 3 cases are linked to the Newport Football Club, 1 a player, 1 a social contact of a confirmed case, and 1 a household contact. That brings us to 13. 3 cases are linked to Mount Alexander College, 2 are students, and 1 a household contact, bringing us to 16. 2 are household contacts from the original Newport family cluster that we announced last week, 18 cases. 1 is a student at Al Taqwa, and the final case is linked to the Jolly Miller Cafe, but relates to a second workplace that one of the Jolly Miller workers also worked at. So that's 20 cases. As Jerome mentioned, we are concerned about CS Square in Caroline Springs, and 10 cases today are linked to that retail setting. It is a reminder for all Victorians, please, to check in everywhere, every time. One of our most recent cases from this outbreak had forgotten about somewhere he went. He's human, that's fine, but due to the fact that he checked in at that gym location, our contact tracers were able to remind him and work through those details with him and link it on our website. And that's exactly why we have that call to all Victorians to continue checking in. It's also why Service Victoria has added a check-in transaction history, if you like, to the app. So if you're not seeing it on your current version of the app, please download the newest version, and you'll see a little clock symbol at the bottom that will list your check-ins for the last 28 days. Any check-ins after 28 days will be deleted. As Jerome mentioned, we do have further cases in the apartment dwellings on Racecourse Road. This impacts both another floor at 130 Racecourse Road and 1 floor in the neighbouring 126 Racecourse Road. So we now have 3 floors who are isolating as Tier 1 primary close contacts. The two towers in general are Tier 2, but those residents who are Tier 1 have been notified that they're Tier 1. We will continue to support them, just as we have in other apartment complexes around Melbourne, to isolate safely for those 14 days. We're committed to supporting those residents, providing them with all the help they need throughout that 14-day period. As Jerome mentioned, we have over 12,000 primary close contacts now related to this outbreak. 2,000 are linked to Heathdale Christian College and 88% have returned a negative test. 1,500 are linked to the Islamic College of Melbourne. 85% have returned a negative test. Over 1,100 that we know about right now are linked to CS Square and 67% have returned a negative test. 800 are linked to the Newport cluster of sites, including the footy club. 77% have returned a negative test. Over 500 are linked to Ilham College and 73% have returned a negative test. And over 100 are linked to Warringah Park School. 88% have returned a negative test. Can I once again thank those school communities and also all primary close contacts who are isolating, be it while they await a negative test result if they are a Tier 2 contact or if they've been at a Tier 1 exposure site and are quarantined for 14 days. Again, we thank you for all you're doing to help Victoria really get in front of this outbreak. I'll pass back to the Minister for questions.
Thanks, Kate. Any questions?
Ilham College, will that be a Tier 1 exposure site?
Yes.
For all students and teachers?
I'll get Kate to take you through all that.
Sorry.
Ilham College has currently been a Tier 1 exposure site. However, as more and more test results come through, we do continue to review the appropriate public health risks for each exposure site, be it a school or another, and we are reviewing that. So there may be changes for Ilham or any other exposure site in coming days. We do ask people, keep an eye on the website for that reason.
There were two people that you said were at Caroline Springs Shopping Centre who didn't work there or anything, just attended the shopping centre. Have you got any kind of suggestions on where they got it from? And if not, does that kind of explain why you guys are really focusing on it, if there's been kind of random transmission in that shopping centre?
Yeah, those two cases were notified fairly late last night, so interviews will continue with those two cases today. We do know they went to CS Square. What we don't know yet is whether it was a fleeting transmission, perhaps in one of the common areas related to the toilets somewhere else, or passing someone in an open area, or whether they went to one of those identified retail sites that Jerome listed before. As we get any more information with respect to exposure sites, that will of course be updated on our website through those interviews.
3 positive cases at the Flemington Towers and their families that have been moved out. Was it mentioned that there were children in those cases that are positive?
They do relate to the Mount Alexander College, so yes, they are school students.
What ages are they?
I don't have that to hand, but we can obviously get you that.
So all 3 are school students?
That's correct.
Are you expecting those numbers to grow at the...
Look, obviously we're still getting in front of this outbreak. We are aware that the Delta variant attacks through households, so as school students or any individuals do turn positive, we would expect to see further positives in those household contacts. What I'm really pleased about is that 5 of our 20 cases today were already in isolation throughout the infectious period, and that's why we're in lockdown, and that's why we're conducting our interviews as quickly as we can, tracing as quickly as we can, asking people to test as quickly as they can as soon as they have symptoms, so that we get that number up.
Which of those 5 were linked to which clusters? Do you have a breakdown of where they were from?
I will need to get you that.
In terms of the numbers now with 15 still in the wild, are we tracking down, are we heading in the right direction with lockdown, and how much longer do you expect it'll take before everyone, hopefully, is in quarantine for their entire infectious period?
I wouldn't want to speculate on how long it'll take for us to get to 100% in isolation during an infectious period, but as long as everyone, continues to do the right thing, we know our primary close contacts staying at home, testing as soon as they get symptoms, Victorians keeping an eye on our exposure site website, that's how we'll get there.
What's your modelling saying? I'm assuming you're looking at modelling for making those decisions. Are we talking weeks or days before we're getting back down to that 0, do you think?
I might ask the Minister to speak to that.
Thanks, Kate. So it is really a day-to-day proposition, as each and sometimes an hour-to-hour proposition. But we've seen one case a couple of days ago being in quarantine. Now we've got 5. And what we want to do is obviously improve on that trend. And as Kate has indicated, That's in all our hands. That's in the hands of everyone in metropolitan Melbourne to follow the rules. It's in the hands of all of us in Victoria to get tested the slightest of symptoms, and it's our thanks to the, I think, 12,000 primary close contacts to be supported in doing the right thing.
Minister, we're not going to get to that benchmark of having them all in quarantine before 8 p.m. on Thursday, are we?
I don't know what the future brings. The crystal ball hasn't fired up lately. What we'll do is follow the public health advice as it comes in on a day-to-day proposition, and obviously we want to have the most up-to-date information before the public health team make their decision, and as soon as that decision is made, we will of course be sharing it with all Victorians.
Do you think that might be before Thursday? Do you think you might reveal more tomorrow?
I don't know. It is really a day-to-day, hour-by-hour proposition, and as the information and the data comes in, the public health team consider it, put it all together, and as soon as a decision is made, I can assure you that will be shared with all Victorians.
How would you characterise where contact tracers are? I think the Premier said yesterday they were keeping pace with it. Where is that now? That
might be a judgment for the Chief Health Officer and his team, but yesterday we had one case quarantining for the whole infectious period. Obviously, incubation and all those things and tracking people down has been pretty good, and all the cases are linked. That's pretty good. And 5, as Kate have indicated, have been quarantining for their entire infectious period. That's good. 15 have been out in the community, and there's been there's been transmissions through a number of schools. So that's on the riskier side of things. So I think it's fair to characterise it as progress, but still some way to go.
Minister, on those 15 cases that were out in the community, do you have an idea of how many were out for, say, a full week while infectious, or did they partially isolate?
I don't, but I know that we can get that material available to you. But what I do know from the reports I've seen is that compared to where we were last Thursday, where people have been out for some time, those exposure periods are coming down. And that's again a result of the measures that the public health team have put in place for both the lockdown, the contact tracing, the testing, and the great community engagement that we've seen.
Minister, they've been out in the community, but is the risk lessened somewhat of transmission given the fact that we're all wearing masks at this time?
Of course, masks have played and will continue to play an important part of risk mitigation. They're cheap, they're easy, and they play a role. So can I just reinforce this message, whether you're in regional Victoria or metropolitan Melbourne, for your 5 reasons, masks are compulsory in all outdoor and in all other settings other than your immediate home.
And of those 15 cases, where are we seeing the transmission? Are we seeing it in household settings, the majority, or is it still at that shopping centre that
As Jerome and Kate indicated, 10 of those cases have been in CS Square shopping centre today. Some of those were in related housing settings, personal close contacts in housing settings. But in terms of what's the actual breakup, again, what we've seen in recent outbreaks is the benefit of the lockdown and the testing situation is that we want to see that transition from workplace and public exposures to people in isolation, in residential situations, and then moving towards, across their period of exposure, being in a isolation situation. So in that regard, we've still got a way to go, but progress clearly has been made.
Deacon's Vice-Chancellor has suggested mandatory vaccination for university students, and that also that Deakin should become one of those mass vaccination hubs. Is the government looking at that, in favour of that?
In terms of mandatory vaccination for universities, I did see the Vice-Chancellor's comments, and I've also seen the comments of the federal government, understanding that workplace regulation for these issues in Victoria at least was ceded to the Commonwealth in the 90s, for workplace by workplace issues. Our main concern is what we don't have at the moment is enough vaccine for people who want to get vaccinated. Yes, there is an important national conversation around at what point do you have to take measures to get us to those very high levels that we all want to get to as soon as possible. The figures that I've released earlier clearly indicate a very strong desire of Victorians to get vaccinated. My main concern is not worrying about, I suspect, an ever-decreasing number of people who are unsure. My main concern is to get the available vaccines into those increasing numbers of Victorians who want to do the right thing and get vaccinated.
Would you look at using Deakin as a mass vaccination hub or other universities?
We'll look at all sorts of partnerships with all sorts of people to make sure that we have the fastest, most effective and most efficient and safest way to get people vaccinated. At the moment, our constraint is not people wanting to get vaccinated, our constraint is the available number of vaccines.
Is one that's not doing the AstraZeneca for under the Werribee State Vaccination Hub is one that's not doing the under 40 AstraZeneca jabs. They have a very young median population. There's also outbreaks happening out in the west. Why isn't that being included?
So the rollout that we announced in terms of the 9 state-run clinics that are vaccination hubs, we will clearly need to ramp those up, and we don't rule out adding to that as soon as the next stage of the system cranks in. I do note that the Commonwealth has released a number of pharmacy sites that will be brought on. My understanding is that they will be AstraZeneca. They're not operating yet. They rightly reflect our argument to the Commonwealth that the West is underrepresented when it comes to GP clinics for all sorts of historical reasons, and that we look forward to those community pharmacies being approved and stocked up as soon as possible as AstraZeneca sites.
How much AstraZeneca does Victoria have at the moment?
The last I looked, it was over 200,000, but we've put a fair dint in that over recent days. In terms of the actual number, given that it's actually made just up the road, I'd have to get back to you. But what we want to make sure is that the safe message that AstraZeneca is available and works and is going to be increasingly available is heeded by as many people.
So when you talk about supply being the issue, if we have 200,000 AstraZeneca doses, what is the constraint then with opening up more mass vaccination hubs or more appointments at those hubs?
We are getting it out as soon as it's allocated to us by the Commonwealth. We don't ride down to Camberfield. It comes via the Commonwealth, and as soon as it gets to us, we get it out.
So that 200,000 you're talking about is not doses that we've already been allocated?
I'd have to get you the exact figure because we've put a fair dint in it over recent days with the new arrangements that we've put in place for the state vaccination clinics and those figures that I referred to earlier. Let me get you the exact figure, but what we want to make sure is that we get the AstraZeneca out as quickly as possible, that we get the Pfizer out as quickly as possible, and we are doing that. Indeed, I think most states are. What we really need is a lift in the amounts of vaccine that we all get, and I note that there's been commitments that Moderna will soon be available, and I look forward to further vaccines being available. That's not forecasted under Lieutenant General Fruin's Horizons plan under the COVID Shield position the Commonwealth has released. That doesn't start ramping up big time until September, October, but we will push hard for all the vaccines that we can possibly lay our hands on to be got out the door as quickly as possible. Because I think what we've seen as Victorians look north to New South Wales and yet again look to a Delta outbreak that needs to be responded to here in Victoria is that they know that the best vaccine is the one that's available now. And what we've got available now is AstraZeneca and Pfizer, and soon we'll have Moderna, and we will partner with the pharmacies, the GPs, the community health centres and our state-run clinics to get those vaccines into the arms of Victorians as quickly as we possibly can.
Minister, do we know if any of our current cases in this outbreak were vaccinated?
We do. Let me get you the exact breakdown.
The gap has been postponed again. Do we know what the impact will be on Year 12s?
I did see the statement put out by Education this morning, and we know that the GAT is an important part of young people's, particularly Year 12's, education process. We look forward to it being rescheduled as soon as possible. Education have put in all sorts of measures over the course of the pandemic to support young people in this difficult time. The tutors, the extra mental health and wellbeing support, the leadership on a school-by-school basis, and I'm sure that is having an impact, but equally I'm sure if there's more that needs to be done, education will take those extra steps.
Premier speculated yesterday that there would be no crowds for the Geelong game down at Cardinia Park, but there is speculation that there might be some sort of crowds. Have you heard either way about what the plan is?
No, I haven't, and that will be a decision for the public health team in consultation with, I assume, the AFL, but all I want to make sure is that St Kilda win and continue their march to the finals.
Somewhat on what you mentioned before, federal data released yesterday showed a similar trend to, I think, last week on vaccination rates by geographical area. So the northwest and west of Melbourne is still the lowest, southeast is just behind. Beyond what you were talking about there about needing to open more pharmacies, why are we not making more inroads in those areas, particularly when there is an outbreak happening in the western suburbs?
It's a result of a combination of factors that you can identify. Firstly, the north and the west is younger than the rest of the state and the rest of metropolitan Melbourne. And we've had age-based limits on access to vaccines for really good public health risk reasons, given the limited supply of vaccines. That's one factor. Another factor is the underrepresentation of that community when it comes to GP distribution sites for the vaccines. GPs, remember, make up about half of the statewide distribution of vaccines, and then on top of that, there's the making sure that we've got the state-run clinic overlay as effective as we possibly can. And then what we've tried to do is to match the state-run clinics to some of those gaps. We all need to do more, but these are all factors of constraints of supply. I look forward to more GPs, more community pharmacies, and indeed more state-run clinics, big and small, all playing their role to fill those gaps wherever they are. And that will be a result of increased supply, which the Commonwealth have assured us, and we're very confident will happen, starting to ramp up in September.
Is there not more that your government could do in the meantime to engage those communities?
Oh, well, I think we are demonstrating as supply becomes available that we are putting the extra resources into, for instance, the school pilot programs that we've run with enormous success in the West. I announced another pop-up clinic just before in the Wyndham area, again targeting those schools. And as the extra 150,000 Pfizer doses that the Commonwealth announced on Friday become available next week and the week after, we'll also allocate those at the areas of greatest risk.
Do you know if there's been any update to the application of the woman in Sydney who wants to travel to Victoria to care for her daughter who's fighting cancer at the moment?
Yes, so I have nothing but great sympathy for the thousands of people who have applied to come from New South Wales into Victoria. But we make, or the public health team, make those decisions on a case-by-case, individual-by-individual basis. And I understand how every case is seen to be pressing for those families, but just today we've seen another record day of infections in New South Wales. We've seen now, as I understand it, the majority of New South Wales locked down. We've seen what was a Sydney problem increasingly become a New South Wales-wide problem. It's an extreme risk zone under Victoria's traffic light system for a very good reason. In regards to the particular case of a New South Wales resident who wants to come to Victoria that has had some coverage, I was approached by the New South Wales Minister and I've asked for further advice on that matter, but it will be determined on public health risk grounds based on the circumstances of each individual case. And I'm sorry to have to say, but the vast majority of cases will not be approved. We are having to triage those cases around access for end-of-life and funeral arrangements and process those cases first. And people should not make the automatic assumption that no matter how valid they believe their case to be, that it will be approved, because you are coming from a really risky situation. And I understand that that will create lots of challenges and disappointments for people, but the public health team's major priority is keeping Victorians safe.
These shouldn't have made an application?
No, not at all. The residents of New South Wales have every right to make an application to come to Victoria, but it will be determined on a case-by-case basis, which will be rigorously applied and will actually be triaged around those cases that are most pressing. And the triaging is for end-of-life and funerals and arrangements such as those.
There's another woman, Zoe Bagnardo, who's trying to get home. She's homeless. She's got 2 young children. Do you have an update on that case?
So again, I can't comment on individual cases, but I would urge anyone to not make preemptive decisions about their accommodation or their travel without first having a response as to what their circumstances are. Each of the cases are determined on their merit. Each of the cases are individually gone through, but I say again, increasingly all of New South Wales is ticking off. The majority of New South Wales is now locked down under the New South Wales government system, and it's been a high risk zone for some time now, extreme risk zone for some time now under Victoria's traffic light situation. And I apologise to everyone that might be disappointed as to getting the answer that they don't want, but I do not apologise for backing in our public health team for taking all the steps that they need to keep Victorians safe.
Just a clarification on hospital visits.
Big pardon?
A clarification, please, on hospital visits for people who are based in the state, in Victoria. We know that one of the listed reasons, limited reasons for hospital visits on the health website is for the patient to have a life-threatening condition. But we've had reports from community members who've been unable to visit patients, relatives, first-grade relatives, with life-threatening and terminal conditions for over a week. Is this up to the individual hospital to impose further restrictions?
Well, I don't know the circumstances of the particular cases that you're referring to, and if you've got specifics, I'm more than happy to have a look at them. But I do point out that under the public health orders, particularly the most high-risk settings, aged care facilities and our hospitals, are entitled to take further measures that they believe are appropriate in their circumstances to manage those risks. Take, for instance, our friends at Western Health, who at the moment, where we had the Joan Kerner Hospital listed as a exposure site, they reasonably have had to take steps to protect their staff and to protect their patients that might well, for instance, impact about how that hospital can go about its circumstances. But if there are particular circumstances that you've got that you need further advice on, I'm sure we can have a look at them.
Regional Victoria came out of lockdown overnight. Have you got a message for anyone from Melbourne thinking of breaching those travel restrictions into regional Victoria?
Don't do it. If you want to have Victoria Police pounce on you, then fine, take a risk, but you'll be caught. You won't get service in regional Victoria, because there's an obligation on all service providers to establish customers being from regional Victoria. They're the negative reasons. But look at New South Wales. Look at the risks that we've seen as a result of people travelling from high-risk zones where it's out of control, slowly but surely taking that risk to the rest of New South Wales. So please, don't do it, and I'm sure that the vast majority, in fact everyone in metropolitan Melbourne, understands that the fastest way out of the circumstances we're in at the moment is by following the rules, and I'm sure regional Victorians would take a similar view.
What would your advice be to people who have events planned this weekend? Should they realistically be bracing for more cancellations?
Look, it's too early to say. I know that we've been in a situation of lots of uncertainty. The pandemic drives uncertainty. The public health team will make a judgment call on the best and most up-to-date data they have, as closest to the position of having to make that announcement for Thursday that they possibly can. If that's Thursday, it'll be Thursday. If it's tomorrow, it'll be tomorrow. But the best and up-to-date information needs to drive that public health decision. And I apologise for the uncertainty that it causes for Victorians, but that is sadly the result of this fast-moving Delta variant requiring us to stay as up-to-date with the information as we possibly can.
But do you think it's realistically possible that we're going to get 100% of all cases in isolation within 2 days?
I don't know what the future brings. I think predictions in a pandemic environment are inherently risky, but what we will do is make the decisions based on the most up-to-date data and as recommended and decided by the public health team.
Jerome, on vaccines, just have you heard anything about anti-vaxxers booking appointments for vaccines and then deliberately not showing up?
No, I haven't heard that one. It'd be an interesting ruse for somebody to try. Look, I mean, we've got 50 public access clinics across the state providing vaccinations. The minister's gone through significant capacity coming through over the end of this month. We've got 96,000 or so AstraZeneca appointments available for booking in over the next 4 weeks or so. So there are now opportunities for people to book in. We're seeing really high turnout rates. We're seeing people come through and get their vaccinations. And look, everywhere we go and what we in the conversations we have, there is a very small minority of people who for whatever reasons don't want to have the vaccine for themselves. That's a matter for them. It's not impacting the role of the vaccine for the vast majority of Australians.
You mentioned that 96,000 doses available in the next couple of weeks.
Yep.
Are there places that have less demand than, say, other ones? Because for people in the western suburbs, there are very few appointments. There are only 3 clinics in Footscray that do it once a week. There are no appointments for the next month. The showgrounds is also booked out.
Yep.
Is there any thought to doing what Sydney is doing and prioritising vaccinations in those areas for those affected people?
So with the additional 150,000 doses that were allocated or brought forward from the Commonwealth stockpile a few days ago, they are being distributed out across our network over the coming weeks, and those appointments have started going in yesterday morning. They are being distributed where we see the demand and the opportunity being higher, so it will go across our entire network. There will be more appointments in those areas of greatest demand and greatest need.
But at the moment in the western suburbs, there is only the showgrounds, which is booked out for a long time.
Sure. Well, of course, we've got Melton, which kicked off on Monday. That's opening up again tomorrow as a significant walk-up centre. We are looking for other opportunities to continue to expand our vaccination footprint, but you will start to see those appointments starting to come up, and we do ask people, keep checking those vaccination opportunities.
There was 34,000 tests yesterday. Where would you like to see that number up around? You call for more people to come forward?
Yeah, look, it's not just about the absolute number, it's also about where people are being tested and where we're seeing the responses. What's been outstanding so far in the first 4 or 5 days of this outbreak is how those school communities are rallying around and getting really high testing rates that Kate's gone through. That's a really strong indication. So on that part of the outbreak, I think, as Brett said yesterday, we're starting to feel that we're closing in on what the transmission routes are in those very busy schools. I think Caroline Springs is an absolute area of concern for us. That's why we focused on it for the last 2 days. I would like to see more people getting tested in the Caroline Springs area. As Kate has said, when we start seeing individual cases coming through, that feels like there's more there that we want to go after. And it's a general message for the rest of Victoria. Remember last Wednesday, less than a week ago, we had 0 cases, and we suddenly saw a number of cases pop up on the board in a very short space of time. There are other cases we suspect out there in Victoria. There are certainly other cases out there in Melbourne that have not yet come to light. We need people to get tested if they've got any symptoms whatsoever. If you haven't been tested yet and you're a bit embarrassed about it and you think it's going to be awkward conversation, just get tested, because we know about this virus. If you don't get tested, the people you infect will at some point get tested, and we'll be dealing with tens of cases, not singles.
How many of the cases we're seeing are new generations of transmission versus kind of transmission from incidents that happened before the lockdown started?
Yeah, that's a great question. So, look, I think we're seeing, there are sort of 6 areas where we're seeing transmission at the moment in this particular outbreak. We're seeing transmission at the schools, particularly at Altaqua and at Mount Alexander College. Very small numbers, nothing to do with those schools, but we have seen transmission in those settings. We're seeing transmission at the Wolf Cafe, again, nothing to do with them, but we've seen a number of cases associated with the Wolf Cafe, 3 generations from one person to customers and then to household contacts. And we've seen transmission at the Newport Footy Club. I think 5 people now associated with Newport Footy Club who have the virus. I think all from that one match against West Footscray the other week. We're seeing significant transmission at Caroline Springs Square, at that CS Square shopping centre, of multiple generations. We know we had one of the original cases who works at the opticians in the square. We've seen a number of either direct associations with him and certainly second generations into household contacts of people who were positive as a result. And then finally we're seeing that household transmission that we always see. What is encouraging in today's numbers and in recent developments is that we are expecting to, we expect to see household contacts come forward. The children who regrettably are in today's numbers, the 4 kids, are all identified PCCs. They're within houses that were locked down when those schools were identified. So we're reasonably confident that we've got those under control. Again, it's those new cases coming up in CS Square, those cases in the wild, that are the most concerned at the moment.
That's probably the one. I mean, schools are shut down, footy club is shut down, so that shopping centre is probably the one where there's any kind of lingering possibility of ongoing transmission.
Yeah, that's right. Look, I think we're still interested in the footy club. Again, we've got it's a widespread social network. There's a lot of people involved in the club. They do lots of active things as footy players do. So we're very keen to ensure that people who are associated, we've got I think 180 primary close contacts associated with that match. We really need to make sure they're all run to ground and their contacts are isolated properly.
Minister, yesterday the Premier pretty much ruled out locking down specific LGAs. Is there any more consideration to allow places like the Mornington Peninsula, Cardinia Shire out of this metropolitan bubble, given that Geelong is 48 kilometres from outbreak suburbs? It's still got active cases, I understand, whereas the Mornington Peninsula, Cardinia, over 100 kilometres away, hasn't had an active case this year.
No, there's no plans to change the definition as to what metropolitan Melbourne is for the purposes of public health orders. And I just ask people in metropolitan Melbourne to just look north to Sydney about what happens when geographic local government area-based decisions are made, when wider communities need to all have to do their part. It doesn't stop in geographic areas. It's the nature of urban living and it's the nature of those surrounding communities that are part of that. So there's no plans to change that, and the alternative is what's been happening of the inevitable creep that we've seen in New South Wales. Any other questions?
Just, sorry, Minister, last one on the compassionate exemptions. So if public health officials come back and they reject, I mean, we've brought up 2 examples now. If those applications are rejected, is the government going to be happy to reject those cases?
I'm never happy that anyone gets a decision that they don't like, and I'm sure that the vast majority of applications that are being considered and are being rejected, that the recipients of that advice won't be happy. But I do not resile from the fact that bringing in thousands of people through a sort of not rigorous process from extreme risk zones that New South Wales is, that won't be good for managing this virus in Victoria. We've seen this outbreak through genomics and the last outbreak through both genomics and epidemiological links, all being seeded from Sydney. We can't allow thousands of people, however worthy and needed, an automatic entry right into Victoria and bringing with it the risk of further seeding. Our main priority has to be the safety of Victorians, and our public health team will be making the decisions based on case-by-case basis with really tough criteria, but focusing particularly on those end-of-life and extremely urgent medical needs that people bring. And again, I apologise if people get a decision that they don't want to hear, but I do not apologise for our public health officials putting the safety and well-being of Victorians first and keeping this virus out of Victoria. Thanks everyone, we'll see you soon.